In our case, we recommend testing for a positive pregnancy test 12 days after the embryo transfer, okay? In some cases, it can be done even before, a couple of days before, but especially if you are doing a blood test. But if you are doing an urine pregnancy test, if you do it before only 10 days after the embryo transfer, the risk of having a false negative is going to be high. Which also can be tricky is that sometimes patients tend to have or to do the pregnancy test like 5 or 6 days after the embryo transfer, and they claim that the result was positive, and then on the due date for the real pregnancy test, the result is negative. This, in cases of IVF, is sometimes because you have used an HCG drug, the Ovitrel, the Gonasi, or any other drug to trigger the ovulation. And the HCG lasts for a few days in the bloodstream of the patient. So the test is positive because the patients may still have some levels of the hormone that has been used to trigger the ovulation, not because they are pregnant. So I wouldn't recommend to test or to carry out the test in the next week of the embryo transfer. So something between 10 to 12 days should be fine. And of course, if the urine test is negative, you still need to confirm it on a blood test, because the urine tests are designed to become positive 4, 5, or 6 days after the lack of the period in a normal cycle. And here we are almost always doing the pregnancy test on the first day in which it could be positive. So sometimes the levels of HCG in the urine may not be too high, and you may get that false negative that it's confirmed as a positive when you do the blood test.